ठीक है बेबी कैसी लगी? रात में गया था वो दोस्त
आज आप लोगों के लिए एक जो बहुत बड़ा तोहफा, ये लेक्चर ये आपके लिए बहुत बड़ी एसेट होंगे इंशाल्लाह। प्रोफेसर AR गेटरेड यूके के टॉप पीडियाट्रिशियन में से हैं और इनको यूके क्वीन से टॉप अवार्ड OBE इनको मिला अपनी सोशल एक्टिविटीज़ और अपनी एजुकेशनल एक्टिविटीज़ और अपने जो है उनके पेपर्स के हवाले से। तो जब हम लोग स्टूडेंट थे तो हमें ऐसे लोग नहीं मिला थे। हमारे पीडियाट्रिक्स हमें बहुत मुश्किल से समझा। आप लोगों के लिए मैं समझता हूँ कि आपकी किस्मत अच्छी है कि आपको इन जैसे लोग पढ़ाने के लिए अवेलेबल हुए। पाकिस्तान में टीचिंग जो है इस वक्त क्राइसिस मैं कहूँगा, क्योंकि हमारे बहुत से मेडिकल कॉलेजेस खुल गए और टीचर नहीं हैं, और जो सीनियर टीचर्स हैं जो जानते हैं उनके पास वक्त ही नहीं है। और एजुकेशन जो है जब हम आगे ट्रांसफ़र नहीं करेंगे आप लोगों तक तो हम अपने मुल्क का मेडिकल सिस्टम ठीक नहीं कर सकेंगे, क्योंकि आप लोगों को जब बेस्ट नॉलेज नहीं मिलेगा तो हमारा फ्यूचर, मुल्क का मेडिकल का फ्यूचर अनसिक्योर है। तो ये वजह है कि हमारी कोशिश है कि इन जैसे लोग, प्रोफेसर गेटरेड जैसे लोग, इनको
तो चलो तो आज ऐसे करेंगे आप कि वी विल स्टार्ट ऑफ बाय फाइंडिंग आउट कि कार्डियक डिजीज क्यों इम्पोर्टेंट, क्योंकि रिकग्नाइजेबल भी होती है और रिकग्नाइज नहीं भी हम करते। तो उनका इंसिडेंस क्या है जनरली, किसी को पता है? क्योंकि इंटरैक्टिव होगा। बिकॉज मैंने जो देखा कि आपकी जो आंखें होती है तो मैं आपको क्वेश्चन पूछूंगा ज़रूर, बिकॉज आई कैन चेक यू एवरीबडी फ्रॉम हियर। ऐसा तो बॉयज ऑलवेज गो टू स्लीप, ऐसा क्योंकि जो लड़कियाँ होते हैं ना ऑलवेज उनकी आंखें में चमक होती है। तो इंसिडेंस जो होता है, किसी को हाथ ऊँचा कर लो, इंसिडेंस फॉर कार्डियक डिजीज रफली per 100 or per 1000, quite common, 1 in 100 roughly, okay, 0.7 per 1000। तो ऐसे समझ लो कि 100 बच्चे जो बीमार पैदा होते हैं उसके अंदर एक का कुछ न कुछ होगा। अच्छा, तो इंसिडेंस इज क्वाइट हाई ऑफ दिस कंडीशन। लेकिन कार्डियक डिजीज को अंडरस्टैंड करने के लिए आपको थोड़ी कुछ फीटल सर्कुलेशन समझना पड़ता है। अच्छा, क्योंकि फीटल सर्कुलेशन है जैसे कि जब बच्चा जो माँ के पेट में होता है तो उसका सर्कुलेशन इज़ वेरी डिफरेंट फ्रॉम आउटसाइड, एक चीज़। दूसरी चीज़ है कि वो इंटरियन पीरियड होता है जिसके अंदर वो चेंजेस होते हैं। वो चेंजेस में कुछ फ़र्क हुआ तो बेबी को कुछ नुकसान होगा, समझे ना? ओके, सो आई एम गोइंग टू ड्रॉ 1 or 2 little diagrams। आपको पेन से ये अच्छा समझ लो कि डस्टर भी है ना साफ करने के लिए? अच्छा ठीक है, ओके। अच्छा समझ लो कि ये दिस इज द कार्डियक डायग्रामेटिकली। आप पीछे से देख सकते हैं, पीछे से देख सकते हैं, थोड़ा बड़ा कर दें क्योंकि मैं I'm going to draw it, you see, as well।
थोड़ा ऊपर करके ड्रा करें,
ऊपर कर दे। अच्छा ठीक है, क्योंकि ज़्यादा तो ऊपर नहीं होगा क्योंकि मैं I'm going to draw something।
ऊपर वाला लाइट में है, हम ऑफ कर देते हैं।
ये ऑफ कर। अच्छा, और अच्छा देखो, this is the normal architecture. अच्छा, एक important चीज़ है, most of the diseases in pediatrics of children, the right ventricle will be involved as a diseased ventricle. यानी कि there'll be right ventricular hypertrophy. समझे ना? That's a usual story, not always. Fetal circulation होता है, तो समझ लो कि इधर प्लेसेंटा है. प्लेसेंटा का काम तो इस for nutrition for the baby, ठीक है ना? तो प्लेसेंटा में से blood निकलता है, which is oxygenated blood, which is pink. ये आता है इधर. जो आप ये समझेंगे ना, तो you'll be able to understand cardiology much easily. जो simple चीज़ें हैं ना, वो आपका जो basis जो होता है foundation, if that's perfect, तो फिर बड़ी में बड़ी building बना सकते हैं आप. Okay. ये right atrium में जा रहा है. उधर से from the right atrium, इनको क्या कहते हैं? Sorry? Foramen ovale, right. So इधर foramen ovale है. That's good. आपको foramen ovale है अभी किसी को? Yeah, about 10% of people have foramen ovale. That's patent foramen ovale. अच्छा, वो postmortem करते हैं तब मिलता है, समझे ना? Okay. So patent foramen ovale is not uncommon even in life. Okay. लेकिन it's usually open in babies. Okay. तो समझ लो कि ये किस्म का flap है. Okay. एक वो चीज़ है. So what happens is that this blood, some of it can go into the left atrium. समझे आप ठीक से? Okay. The other blood, इस valve का नाम क्या है? Tricuspid valve. Okay. So tricuspid valve से right ventricle में चला गया blood. So far so good. इधर से किधर जाएगा वो blood? Pulmonary artery. Okay. Pulmonary artery से blood किधर जाएगा? We're talking about inside the mother. एक हाथ ऊंचा कर लो. Sorry? Does it go to the lungs, most of it? Where does it go? To the aorta. How? Fantastic. Okay, so ductus arteriosus हो गया. इधर aorta. Aorta निकलती है इधर से ऐसे. समझे ना? Okay. So इधर से it will go to the brain and that will go to the body. ठीक है ना? अच्छा. समझ लो कि ये body में आ गए. Comes here, becomes blue, becomes deoxygenated at some point, and then the placenta makes it oxygenated again. Okay? तो ये एक चीज है. और ये जो lungs जो है, lungs में क्यों blood नहीं जाता? Because there's a lot of increased pressure in the lungs. They're collapsed. Some lungs को collapse कर देंगे. ठीक है? So जो कोई चीज़ collapse है तो उसमें तो blood तो नहीं जाएगा ना. Okay? So what happens is थोड़ा तो जाना ही चाहिए. Some blood has to go, but most of it goes through the patent duct. ये जो है, this is crucial for the baby to live. Okay, this is crucial to me. So two things I want to tell you. In utero, patent ductus is crucial. In utero, right ventricle is the main ventricle. This is in utero. Right ventricle is a thicker ventricle. Now, at birth, this is such an important thing. At birth, changes occur. So what's the first change that occurs at birth? First change. What happens first? What's the first thing you do to the baby or mother? Clamp the cord, right. So that's gone. Okay? So now, once that is gone, sorry. Okay. So once that's gone, the baby actually now is relying on something completely different. So once that's gone, now it's interesting. This was which was this vessel? coming up to the right atrium. उसका नाम क्या है?
Probably they can't hear actually.
Inferior vena cava. Yeah? So that inferior vena cava now is actually carrying blue blood. Agreed? It's coming back from the body. वो placenta से चली गई ने? समझा? Are you with it? Right, fine. इधर चला गया. दूसरी चीज़ हुई, thank you. दूसरी चीज़ होती है, this baby is going to go. That's what the baby does at birth. How much pressure do you think the baby has to expand its lungs? 100 centimeters of water. आप baby को 100 centimeters देंगे, you probably cause a pneumothorax. But कुदरत ने पहली जो है ना, पहली सांस लेता है, 100 centimeters. What happens during that 100 centimeters? What do you think? Why does the baby give that first gasp? Alam yani ka breathe. Yeah? So the baby is. Do you know what happens? वो जो alveoli होते हैं ना, उसके अंदर पानी होता है, amniotic fluid. That gets absorbed. तो उसके अंदर फिर हवा आ जाती है. जब हवा आ गई, तो pressures decrease हो गए, lungs expand हो गए. जो lungs expand हो गए, तो pressure कम हो गया. Pressure कम हो गया. What happens then? The blood can flow to the lungs. Right, okay. So, changes at birth, as a summary, that is gone. Next thing, lungs are expanded. Good. So, lungs expand. Okay. Lungs जो expand हो गए, okay. Is everybody now concentrating? Yeah? Okay, good. So lungs expand हो गए. Lungs expand होंगे, there's more blood going to the lungs. Now this is oxygenated blood जाता है ना? अच्छा? क्योंकि पहले तो इधर से oxygenated blood जा रहा था. Now what's happening is that blood, because the lungs are open, there's more blood going to it. But now the left ventricle, because morphologically उनको कहते हैं कि left ventricle is getting a bit stronger now. Patent ductus usually starts to close up. Okay? Lungs have opened up, remember. So what's going to happen is lungs are now sending oxygenated blood to the left atrium. Agreed? Okay. So they go through which valve? Mitral valve. Good. And then the blood goes through into the aorta. So now it's a different system. So now you've got pink blood, oxygenated blood, the lungs. So the lungs have opened up, placenta is gone. What's the pressure roughly between left and right atrium, millimeters? There's not a big difference, but left atrium is more than the right atrium after birth. तो क्या होगा कि ये जो चीज़ है ना, वो बंद हो जाएगी. It closes the flap because there's more pressure on the left than on the right. So the blood won't leak out from the left to the right. Simple? Yeah? Okay. So there's another change that occurs. So if I was to give you an essay on, tell me bullet points on what changes occur at birth, then you'll be giving me bullet points in a few minutes. Okay? So that closes up. And the blood's going there now. Right. So can you just tell me the first change that occurs after birth? Lungs open up. Next. Placenta stops. So circulation alters. Sorry, just the person who asked the question too, yeah? Sorry? Ductal arteries close it. Sometimes it might not close. What sort of babies it might not close in? Do you know? The more premature the baby is, the longer the patent ductus will remain. Now, patent ductus can be a nuisance, or patent ductus can be life-saving. Okay? And I'll tell you in a minute why it can be life-saving. But just keep that on the back burner for the moment. All right. So if you can see the changes at birth, the baby, it takes place. Okay. Now remember that alamiane jo banaya hai left ventricle ko. The left ventricle is the one that gets the muscle. Right ventricle is not made to survive giving blood to the whole circulation. Left ventricle is the powerful one. So now the left ventricle starts getting stronger and stronger and stronger. And the right ventricle का जो वो है ना, उनका power कम हो रहा है. Okay. So when you examine a newborn baby, can you hear me at the back? सब सुन सकते हैं मुझे? Okay. When you examine a newborn baby, so when you see a newborn baby for the first time, okay, if you put your finger just under the xiphisternum, newborn baby, it will go. You can feel the impulse, xiphisternum. Okay. For the first few days, you'll feel that. But if you feel it at 6 weeks, put your finger there, it's going like that. There's something is not right. So the point I'm making is, by the time I've finished with you, you won't need this. Okay? This is just to confirm what you should be hearing. I'm going to go through with you very slowly with some of the lesions in pediatrics whereby you've almost made a diagnosis before you get this. All right? This is just for confirmation of some parts of your cardiac diseases that can't always be found. You see, in pediatrics, in medicine, you have to use everything you've got. There's the eyesight, there's the smell, there's the hearing, there's the feeling. All those things are important in terms of making a diagnosis. And the worst thing you can do is not look at the patient. You see, many times I go in the ITU and they say, oh, well, oxygen, such a TK, yeah, TK. I said, look, I don't want to know. The patient is blue. I don't give a damn about this 100%. Right? That kid is not right. Yeah. So either the kid's not right and that's fine, but I don't want to know about 100. I want to sort the child out. Okay? So you look at the child and it's called inspection, which we'll go through a little later on. Okay. So we've done the changes at birth. Now, what I want to tackle next is the concept. Are there any questions so far? No? Clear, right? So, and then what I will do then is I'll ask Mr. Aslam to actually repeat this lecture for you, because he's a pretty good doctor, you know. Mr. Aslam, he's been with me a long time, so he knows half of the stuff. Okay. Abhi, there's a simple concept of left to right shunt and right to left shunt. So, just one at a time, just put one person puts if they know the answer. Give me one example of a left to right shunt. What does left to right shunt mean? Just one person puts hand up and tells me, because I can't hear three things. Haath ucha karo, no problem. Because everybody talks and you're drowned and I can't hear you, you see. Confidence about karo. Huh? You're going to be doctors. Huh? What? Right, ventricular septal defect. And did you say another one? Atrial septal defect. So as you're at it, tell me the third one. Patent ductus arteriosus. Fantastic. Okay. So let's just draw another heart now. And just put these lesions in position. Okay? पीछे से देख सकते हैं आप? Okay. Alright, we'll do a simple one for the moment. Okay. That is what we call hole in the heart. ठीक है ना? Right atrium, left atrium. There's a hole. ASD, agreed? But there are two types, aren't there? We'll talk about the simple one, which is, what's the simple one called? Which type of defect? Secundum. Yeah? Secundum defect. Agreed? Okay. Primum defect, ASD, is not a nice one. It would be there. Okay? So that would not be the case. It's sort of like so. In other words, it's the defect is there. That's bad. And children with Down syndrome have something like this more than anybody else. That's called primum ASD. That is bad because it often involves the mitral valve as well. And it's difficult to sort out. And the child is ill from the word go, from birth. Okay? But we'll talk a little bit about that a little later on if we get the time. तो थोड़ी चीप सिंपल रखेंगे हम, अच्छा ठीक है ना? तो हम बात करेंगे ये ASD की इधर. तो ये ASD हो गया, ये VSD हुआ, which is that one. ASD इधर हो गया, VSD इधर. Patent ductus मैंने आपको बताया. It's between the aorta and the pulmonary artery. Okay. So those are the three things that happen with left to right shunts. Left to right shunt means the blood is going from the left side to the right side. Left side is stronger than the right side, so if my right hand is stronger than the left, it's going to push my left hand out. So, if the pressure is high here, and the pressure is very low here, it'll go, so it'll make a noise, and that noise we call a murmur. Exactly. Now, this is important. ASDs at that level should cause a murmur, but they don't. Because the pressure is very low. It's just between 5-6 centimeters, 3 centimeters. So इतना pressure difference नहीं है. जो pressure difference ज़्यादा होता तो turbulence होता. Turbulence होता है तो noise आता है. वो noise को हम murmur कहते हैं. अच्छा. So that's one thing. So what happens there? Is the child pink or blue? Pink, exactly. So with left to right shunts, children are pink. Talk about VSD now. Okay? VSD, exactly the same thing. Left ventricle is stronger after birth compared to the right ventricle. It takes a day or so for the left ventricle to be as strong as the right one. Might take a day or two longer. But it should throw the blood from there to there if it's a VSD. Okay? So that's left to right shunt. Now let's look at the other situation. From the right ventricle, after birth, what comes out here? Pulmonary artery. Good. I'll just actually do this like that for the moment. Okay. Now, is the pressure high there or there? Pulmonary artery or aorta? Aorta. Right, okay. Left ventricle pressure is as good as aortic pressure. Okay? So, if there's something in between there and there, and the left ventricle is going, okay? It goes in there. Now the pressure, say, there is about, say, 20. This is a matter of discussion. The left ventricular pressure, say, is about 80 over 30. This is a matter of discussion. We talk about newborn babies. 80 is higher than 20, it goes in systole. Agreed? In diastole, the pressure is only 30. But it's still higher than 20, so it goes So what's that murmur called? Machinery murmur. So patent ductus causes a machinery murmur. Okay? Now, if the pressure there is high-ish, which is the case after birth, because it takes a few days for the pressure to fall on the right side. Although the lungs have opened up, pressure takes time. So you only get a systolic murmur, you'll get a shoo, shoo, in the pulmonary area where the patent ductus is. But as the pressure continues to fall on that side, you'll get shoo, 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 shoo. Machinery murmur occurs in patent ductus. Left to right shunt. Any questions? Clear? Okay, fine. Now, when we look at right to left shunts, you can have them in two ways. Either you are born with right to left shunts, or they are created later on. So let's give you an example. Let's give you an example of this VSD. Okay? Are you all with me? Yes. Now the VSD, just say it's a large one. And there's a lot of blood flowing from there to there. Now, the right ventricle is not really made for large pressures. In utero it was fine. But outside, because the left ventricle is so much stronger, it's just pumping the right ventricle. Left to right shunt, baby is pink. Okay. What happens to this blood goes in there into the pulmonary artery? Agreed? That's the only place it can go. You agree? Right. So what happens to the lungs is that the lungs there get congested. Because that blood, the left blood, is going to the right, going in there and congesting the lungs. So when you get lung congestion, you get cardiac failure, pulmonary edema. Right? If the pulmonary edema carries on, the lung says, Baba, I am really, main thak gaya. I am tired. So they start developing pulmonary vascular resistance. So they become fibrosed because they're just getting fed up now. So what they're saying to the right ventricle, apne blood bheja hai, keep it. Okay? So the right ventricle says, Baba, okay, I will keep it, but the only way I can do it is by getting stronger. So it gets thicker because it wants to push it back again into the... But it can't, it doesn't win. So what does it do then? It says to the left ventricle, Baba, it came from you in the first place, you can have it back. Okay? So what have you got now? Right to left shunt. What happens to the baby's color? It goes blue, right? And what is this condition called? Eisenmanger Syndrome, right. So you know a lot of this, don't you? That's good. Excellent. So that's Eisenmanger's. Now Eisenmanger's is unusual with small secundum defects. It can happen with patent ductus. So in countries like Pakistan and Africa, and then you can get Eisenmanger's because they're not operated. In the UK, you don't get Eisenmanger's because we pick it up, sort it out, clear it. Okay? But you will get Eisenmanger's here. And how can you tell it's an Eisenmanger's? Because you know what, something, forget about using the stethoscope. You know, doctors always think, by putting a stethoscope, you make a diagnosis. You know, parents think, fantastic doctor because he uses the stethoscope. Do you know the doctor that uses hands, eyes, fingers, and then uses a stethoscope? That's the doctor you want to meet. Okay? If the person has got Eisenmanger's, okay, had a VSD to start with, the VSD would give you probably a left atrial enlargement, yeah, big one, pulmonary edema, you'll be able to hear the crepitations because of pulmonary edema. Child is going bluey over the next few months, next few years, right ventricle. Because now you're getting pulmonary hypertension. Because that's what that thing is caused. It was pulmonary hypertension that produced the backflow that resulted in your having the right to left shunt. So the right ventricle is strong now, stronger than the left, remember. This is the only reason why it's throwing the blood back. And left has got a pressure of 80 or 90, right one's going to have higher. So you'll feel the right ventricular impulse under the Ziffy sternum. You can, if you put your hand like that, feel it's called a right ventricular heave. Heart is it's called like that. That's a right ventricular heave. So you should be able to pick up a right ventricular heave if you've got a right ventricular enlargement or hypertrophy. Are you with me so far?
Yes.
Clear? Excellent. Okay, so we've got left to right shunts and right to left shunts created by what was at first a left to right shunt. Fantastic. Everybody's awake so far. Okay, so let's take a different situation. You see, I tell you one thing, you wouldn't believe it, but these lectures I gave to doctors who are, we've got 7, 8 stages, yeah? They become doctors FY1, FY2, ST1, 2, 3, 7, 8. The lecture I'm giving you, I give it to those guys who become consultants. And consultants actually come and sit, because some of them don't understand it. There was a time when I didn't understand it either, okay? So you're in good company, but I think I understand it a bit better than I did before. Okay, so now, next thing we will do is to say, well, let's look at the type of lesions that are there in cardiology. Because, you can't just say, I'm looking for this, or I'm looking for that. You've got to have some idea in your mind. And nature is so clever. Because nature has divided things. I told you, it's 1 in 100 roughly. Okay? तो जो वो lesions होते हैं ना, generally common lesions, 85% of them are made up of 8 lesions. Right, so let's go through it now. I'll wait you up. Of 85% in one of them. G2? Arteries. Name a lot of lesions out.
Septal defects.
Which one?
Ventricular septal
Ventricular septal defect. Okay, ventricular septal defect is one. If in an exam you are in doubt and you hear a murmur, say VSD. You know what?
Yes.
Because 33% of the time you're going to be VSD. As long as the time is good. This is a, don't tell your teachers, yeah? Left sternal edge, murmur, pink child. Yes. 33% of the time you'll be correct. And you're looking for a standard attitude. So VSD is one. Atrial septal defect 2. So the 2 holes in the heart are done. They are in pairs. Okay, आपने ये holes जो है वो कर another pair. Patent ductus artery. This is extracardiac lesion. Extracardiac lesion through this outside the heart. Can you think of another condition that's outside the heart? Coarctation. Right. So you got 2. So those 2 okay. You got 40% of the 85%. Another lesion. The 2 blue conditions are and transmission red vessels. Fantastic. So we've got those that makes it 6. There were 2 more. Cyanosis. Let us go here. Aortic Stenosis and Pulmonary stenosis. Okay, so that's it. It's done. If you understand those 8 lesions, you've understood 85% of cardiology. As long as you've got this particular basis, foundation. This is the foundation that you've got to have. So you've got to got 85% of these lesions. Now, let's just briefly talk about each one of them. And for VSDs, I can talk about an hour. Okay? Each one of them is an hour's lecture. But I'll just spend a few minutes on each and give you some salient points. And then hopefully we'll just do a small, short, sharp summary. But before that, we will do an interactive workshop. So one of you will come and work with me, because I'll bring a baby to you. He's not feeding very well, losing weight, okay, and sometimes maybe going blue. So you'll be taking a story from me, and then I'll show you how to examine the baby. Okay, so then you can appreciate how it's actually done. Okay, So let's look at VSD to start with. Now, if you were working with me, all right, you examine the baby, and you looked at the heart, and you said, yeah, doctor said, right ventricular impulse is quite normal in the first day or two. Yeah, that'll be fine. Good listen. There's no murmur. No murmur. Now, in England and in America, they sue you if you miss things. 3 weeks later, come and listen to the doctor say, and finds he's got a murmur. Right? If you're in England, you get sued. Why? What should I tell you that? Aisha. There's a why did Aisha miss this, and we'll have to sue you. But if I was your consultant, I'd say, listen, Aisha knows what she's talking about. Okay? She was actually right when she examines the baby, and there was no murmur, and I'll agree with her. And they'll say, why? So why? Why does this baby develop a murmur 3 weeks later, and Aisha missed it? And when she missed it, it actually wasn't there. Okay, let's work on that. All right. Now, for that to happen, you were answering when I was looking that way, so I don't know. So you could answer when I'm this way. Okay, so, anybody answering? 2 read the question, 3 or 4 is this will be too simple. Pressure difference, fantastic. That's, brilliant. Pressure difference. Because remember, right ventricle was quite strong, left ventricle wasn't very strong. So then, what happened? Yeah, VSD. Yeah, leave that for the moment. And you had your VSD here. Pressure on the left side and on the right side. Right side was higher. So that's the reason why it was working better. Left ventricle isn't that useful in utero. It's not doing much. Okay? Although you don't want it to be a hypoplastic left heart, which is a horrible story. There comes a time when the right ventricle is strong, left ventricle is getting stronger, so there's no pressure difference. So you can have quite a biggish hole, but no flow, no pressure difference. So you won't get a murmur. Murmur only occurs if there's a pressure difference. So that's a very important point that you made. Is there another reason why you might not get a murmur? Now this is for your distinction question. Okay? All right? What's the hemoglobin of a newborn baby? 18 to 20. All right? So if hemoglobin is flowing through a tube like that, and if water is flowing through a tube like that, it will make more noise. If you have drunk oil, if you have drunk water, and if you're shaking about, what would make more noise? Water. So water is thin. That's why when you guys and girls become anemic, certainly girls become anemic during pregnancy, you will have a murmur because the blood is thin. So it makes a bit of a noise. If it's thick blood, it doesn't make much of a noise. So if it's thick blood, it won't make as much of a noise, so you miss murmurs. Yeah? So a couple of reasons why you won't hear a murmur.
3 months के बाद 3 months के अंदर क्या ब्लड ठीक हो जाएगा?
नहीं। ब्लड की जो चीज़ है ना, उनके ब्लड जो थिक होता है ना, हाँ तो ब्लड थिक है और प्रेशर डिफरेंस का प्रॉब्लम है. तो murmurs you don't hear them. Sometimes you hear it, but if you miss it, you'll hear it better later on. समझे ना? जो ब्लड जो है ना, ब्लड की हीमोग्लोबिन 18 to 20 होता है जब बच्चे का जन्म होता है तो. अच्छा, वो धीरे से कम हो रहा है, and by the age of a year it might be 11 or 12. समझे ना? Okay? Depending on whether you got, but you see there are lots of other things coming to it, whether you got thalassemia or not. You know, lots of other things you need to look at as to, assuming nothing else is going on, that's what will happen. समझे ना? Yeah? Okay. So we know 2 reasons why we didn't actually hear the VSD. Okay. So now, as far as the VSD is concerned, where would the murmur be of the VSD? Left. Right. We'll have it at the left sternal edge. There. Just near that left nipple. Okay. So let's go through where the murmurs will be. VSD murmur. pulmonary area, you get patent ductus arteriosus. Yeah? Okay. Patent ductus arteriosus will be there as well. What else will be there as well? Pulmonary stenosis. Good. Okay. Now what about ASD? Where is the ASD murmur? There's no murmur. Okay. I accept that. Because of the pressure difference? Okay. But you still hear a murmur though. Yeah? You still hear a murmur if you have a good listen. In an ASD. Let me show you how. And this is where one huge learning point comes in. Okay. So in an ASD, you've got the blood flowing from left to right. Agreed? Everybody awake at the back? Ijaz साहब आप जरा उनको ठोसा मार देना एक दोनों को जो वो सो रहे हैं तो. Left to right shunt. Okay. Finished? Everybody talking? Yep. Okay. Left to right shunt. Where is this blood going to go? Into the right ventricle. Where is it going to go from there? Into the lungs. Through an artery. So there's too much blood flowing through into the pulmonary artery. What's it going to make? A noise. So it's a flow murmur. So you'll hear a flow murmur in the pulmonary area. And then you will say, Baba, ये pulmonary stenosis है या ASD है. Pulmonary stenosis murmur is slightly harsh. ASD का murmur जो होता है ना, it's not as harsh. But ASD, there's something else. You see, nature is so clever, and I won't give you the reasons why it happened because it becomes a very long lecture then. Tell me about what happens to the second heart sound in an ASD. How does the heart beat? It goes depending on your breathing. That's what we listen. ASD, secondum type, it goes. And I'm saying, why isn't it becoming single? And there's a murmur there. That murmur is a flow murmur. And drop is the fixed second heart sound. So if you have multiple choice questions here that Dr. Saab has kept for you, fixed heart sound occurs in ASD. Okay? Right. Any questions so far? You see, what we're doing is pathophysiology of how and what we're going to do. Because when we listen, we're going to... You see, what I'm going to show you is that you are going to make a diagnosis of nearly 85% of lesions without using the stethoscope. Okay? We've done VSD roughly, we've done ASD roughly. We've done patent ductus. What sort of a murmur is in patent ductus? Machinery murmur, unless the pressure on the right side, which is the lung, is high. Which will be the case in the newborn baby, and you only get a systolic noise. Fine. The next thing we've already done is coarctation. What is the crucial thing in coarctation? I just want one. Sorry? No, coarctation की बात है.
We have a coarctation and we need the patient to have a patent ductus for it.
No, I know where you're coming from. जब coarctation होता है ना, उनको critical coarctation कहते हैं. At that time, the patent ductus is open to keep them alive. But that's of those 15% of lesions you might be saying. How कहते थे you're putting your hand up? Sorry?
Location of coarctation.
Yeah, what about the coarctation? How do you diagnose it clinically? Sorry, one person, please. Hypertension, yeah, it can give you hypertension. You're absolutely right. Simple way of hypertension. Sorry, difference?
In the blood pressure of upper limbs and
Upper limbs, yeah, there definitely be. Even simpler than that, Baba. Sorry? Radiofemoral delay, yeah, even simpler than that. Okay. You just feel the femoral pulses. You know something? I've been in cardiology for years here. Talk about femoral femoral radial delay, even I can't take it out. Okay. You feel the femoral pulses. If those pulses are absent in a baby, that is some sort of emergency. Because you don't know where the coarctation is. You don't know whether this baby has got what's known as hypoplastic left heart. So if you don't feel, one big lesson for the day, you save a life. If you don't feel the femoral pulses in a newborn baby, that is serious until proved otherwise. Somebody else has got to prove this. Because you'll be missing a condition called hypoplastic left heart, which I won't go into. So that's a killer. Okay? Baby is fine, he's feeding well, goes home, good sized baby, subacute care, couldn't hear a murmur, right? घर जाके एक हफ्ते के अंदर मर गया straight. Comes in left ventricular because of hypoplastic left heart. Left heart has not formed. What was keeping it alive was the patient. वो बंद हो गया, बचा नहीं. समझे ना? But I won't go into it because otherwise the lecture will last 3 hours. Okay. So we've talked about the coarctation, and I will go through with you how you examine the pulses in a minute. Any pulse you examine in children, another big lesson is do not use your thumbs. Okay. The thumbs, right, over there, like a lot of people do, a lot of doctors do, a lot of consultants do, ऐसे जो करेंगे, okay, shouldn't do that. Fingers, okay, fingers, wherever it is. Brachial pulses, okay, carotid pulses. In babies, carotid pulse is not a good idea, because you can't feel it. In older children you can, okay. So babies, radial and femoral pulses. Not easy sometimes, because babies, babies are babies, aren't they? We're all babies. And we don't say, okay, examine me, I'm just going to be still, not going to cry, not going to poo and pee. They do all sorts of things while she's doing it. A number of times I'm standing there and straight onto me, A number of ties that I've got some lovely ties actually that patients have given me, which are all the people you can think of in the Disney world. There's Mickey Mouse and this mouse and that mouse. But all of them have been for cleaners, Somebody's paid on them half the time. Anyway, so you have to remember that that's actually important in terms of examining them. So we've been through lots of these. Now it comes to aortic and pulmonary stenosis. In terms of learning points, what I want to teach you is that in a slightly older child, you're told about thrills. What does a thrill mean? What's a thrill? It's a sound. The sound is something you hear. Thrill is something you feel. If you have to say, definition of a thrill is palpable murmur. So then Alamia has told me, look, and use your fingers. Okay? Yeah, I can feel a thrill here. So the murmur must be louder there. So it's unlikely to be a PSP. It's probably a patient or a stenosis. So we're talking about not only stenosis and aortic stenosis to finish off the 8 lesions. Okay. Aortic stenosis in an older child, you feel in the suprasternal notch. I'll keep your finger and you can put finger into your suprasternal notch. And if you, I hope you don't feel any thrills there. Because if you do feel a thrill, go and see these guys. So, suprasternal notch through aortic stenosis, usually. Occasionally, but the beauty of pulmonary stenosis is that you hear a murmur in the pulmonary area and also the tongue. Usually, because in pulmonary artery, what happens to it? It goes more to the right. The main branch goes to the left. So you hear it more on the left, the murmur, than on the right at the back. So that's how you would say, yeah, I think. See, what you're trying to do is you want to work out in your mind what the diagnosis is. Do you know something? Even now, I think it's this, and I get an echo done, and it's not that. But most of the time, if you clinically work it out, you can be right. And the beauty is not going to the echocard. The beauty is using your brain, and we haven't even used this. Yeah? Because we make all these diagnoses. How are we going to do it? Now, there is one clinical sign which is important, patent ductus, which I haven't spoken about, which is that in an older child, you feel the pulse, whereas in a baby, I feel the dorsalis pedis. And dorsalis pedis is going. What's all that about? Have you ever felt dorsalis pedis? You have? So, dorsalis pedis, pulse, something like that. That actually puts you on guard. This could be a patent ductus. Yeah. Then you say, patent ductus, what does it give you pulse-wise? Sorry? Collapsing pulse, right, okay. And what's the other name for collapsing pulse? Water pulse, okay. So that's what you need to do. You say, I think this is that. This is not a bouncy pulse, but it's actually a collapsing pulse. Bouncing under your fingers. Okay. So it puts you on guard. Yeah, it could be patent ductus. All right. So I've dealt with you so far 8 lesions. I've done you left, right. So, shunting. We've done fetal circulation. Any questions? No? If you want to have a break, that's fine. Don't have a break, that's fine. So if you want to just stand up and just do your leg, talk to each other or swear at each other, do what you want. Just get yourself a bit sort of, otherwise you will go to sleep in a minute. Zara, khada hoke. Dance to mat karo. Just stand up a bit and just get your circulation going. Then you know. सबको सीखा होगा साइनोसिस ये वो ब्ला ब्ला दिस चाइल्ड इज साइनोस या कभी कभी देखा होगा मेडिकल स्टूडेंट फाइनल में इयर्स में हो गया तो देखा ही होगा जरूर जो नहीं देखा है तो वी गो बैक 2 years या ओके तो साइनोसिस क्या चीज है अच्छा नहीं तो राइट ब्लू कलर Anything cyanosis, why do you get cyanosis?
When your blood, oxygenated blood gets mixed with the deoxygenated blood.
When? Sorry.
Light.
Actually be very low with oxygen and not become cyanosis. That what comes the oxygen. Anemia. Good. So can you build on that? So what she's saying, which is fantastic, that's a distinction question. Anemia, distinction answer. Anemia, if you're severely anemic, you will not become cyanose. Because if you do become cyanose, and you're anemic, it's really hard, needing treatment underground. Okay? So, we just expand on that. What makes you anemic? What makes you cyanose? Hemoglobin is 8, you become cyanose. You're in trouble. I saw a baby yesterday that was going for an operation, for a cleft operation. They said, we look at hemoglobin 8 at 600 baby only. No going to take an anesthetic. Should be at least 10 milligrams. How much of the oxygen, hemoglobin should be desaturated for you to become cyanose? How many? किसी ने कहा 5 grams, okay? Now 5 grams is easy. If the newborn baby has got hemoglobin of 18, थोड़ा कुछ होगा तो blue हो जाएगी. Yeah? 5 grams is easy in a newborn baby to become blue. Yeah? If it's an anemic baby, it will take time. If that anemic baby becomes blue, you are in big trouble. So cyanosis means deoxygenated blood, 5 grams or more. Yeah? 5 grams or more. Okay, so now let's look at the two blue diseases. And these are not nice to have. Now, let me just go back to VSD. VSD, and I will tell you how. Once I got caught, second time, I think I was wiser. This is what happened. Baby came to see me, or I saw the baby, made a diagnosis, quite rightly, I think. Baby has got, I want you to go through this process quite nicely because it can easily fox you. Baby's got a large VSD, okay? Quite a large VSD. What will large VSD do in a newborn baby? Because that's helping you with your questions, okay? For your questions. Large VSD will give you pulmonary edema, left ventricular failure. Okay, just briefly, heart failure. Tell me two things about heart failure in babies, clinically speaking. What's the pulse? Pulse is high, might be weak, you're right. A weak pulse is when you're dehydrated more, yeah? Pulse is good, more than 180, 200. Pulse is high. But pulse might be high if you're hypoxic anyway. It could be respiratory. And the liver comes down. Hepatic enlargement, tachycardia, cardiac failure in a baby who's got a murmur. Simple. Right, so this baby is the baby I've got. I treated the baby with cardiac failure. How do you treat babies with cardiac failure? You give them oxygen. What else? Mind you, if it's a pregnant woman, you might give nitrous oxide. That's a different story. Okay, so you give them oxygen, and then you can give them something to make them pee on me. Diuretic, furosemide, okay? And then you can give them captopril, or you might give them digoxin. Some people give, perhaps it's in different developing countries. So captopril, you should give 3 times a day. Lisinopril, once a day, so it's better. Because mum might have 3 other children, she forgets to give. Lisinopril, once a day, okay. Anyway, coming back to this baby. Happy VSD, see the baby at 3 months. Baby's better, fine. And then I see the baby at about 7, 8 months. And the fingers are looking a bit blue. Yeah? So I said, this is not right. What do you think is happening? So let's go through what happens. Okay. Left to right shunt. Blood's going here a lot. Left to right shunt, yes? VSD? We know that. But in this case, the right ventricle says, I'm really getting fed up with this, you know? So, although the lungs are not liking it, the right ventricle gets thicker. So when it gets thicker, you've got a VSD, you've got right ventricular enlargement. You've got 2 things. Okay. Then, remember it's thickening, so it's causing a narrowness going into the pulmonary artery. Yeah? So what have you got? Sorry, I can't hear you. Pulmonary stenosis. In effect, you've got pulmonary stenosis. So now you've got 3 lesions of a condition that has got 4 lesions. VSD, right ventricular hypertrophy, pulmonary stenosis. And the 4th one doesn't matter. Overriding over the 4th one, so the condition is acquired phallus tetralogy. Okay. So that's what can happen to a VSD. It can look like an acquired. But what happens there, you look at the nails, and I thought this is not right. So, but the beauty was, remember, going back to the science, the beauty was that baby is now developing what? I'm not going to tell you, you tell me. When I examine the baby, right ventricle is enlarged now. It wasn't then. But why am I feeling the right ventricle now? It's telling me my diagnosis is not right now. It was right then, but something else has happened. Okay? So can you see, your feel, your eyes are important. Okay? So coarctation, you already told me 4 things happen. That's why the children are blue. So which is the most important? You told me 4 lesions, including overriding aorta. Which is the 4th lesion? Sorry, which is the most important of the 4 lesions in coarctation? One guess only, because if you guess anything, you get...
Hypertrophy?
No.
Stenosis.
Pulmonary stenosis. That's the one that's going to make the baby blue. Otherwise you wouldn't know. Yeah? Hypertrophy could have caused it. Okay? So you're almost right. But pulmonary stenosis is crucial. And some people are actually born with pulmonary stenosis and the other 3 things. So they're born with phallus tetralogy. But phallus tetralogy is not the commonest reason why babies are blue. Commonest reason is actually transposition in the cardiac sense. Otherwise it's respiratory problems. Okay? So if it's a cardiac problem, usually it's a good, what I call fish and chips baby, you know? Good sized baby, solid blue. So if the ringman says solid blue fish and chips baby, I call it. Probably know that, even without looking at it. Because that's the commonest cause of a cyanotic heart disease at birth. Okay. So that's that. Now we come to the most complicated, and this is why I wanted you to stand up and have a bit of a wiggle, because this next one, either you know it or you don't know it. Okay? So I'll try and see if I don't. Because sometimes when I draw it, I get lost myself. Okay. That's your heart again. And this is the 8th lesion we're talking about. And the 8th lesion is which one? The blue one? Transposition. Okay. So right. Do you want to come and show me what the circulation is transposition? No? Anybody have the guts to do it? Yes, come on. No? Okay. So I tell you what, you follow my pen and tell me to stop. Okay? Transmission of red vessels. Okay. I'll give you the ventricles, because ventricles are not transposed. Right atrium. Right. Sorry. Left atrium. Okay. Oxidase. I told you, didn't I? I would get confused. Okay. Right. So, tell me a vessel coming out of here. Pulmonary aorta. Pulmonary. Right. Blue or red? Blue. Okay. Red. Blue. It's like a television program, isn't it? Blue. Okay, so let's make it blue. Oh, sorry. What comes out of the right ventricle? Aorta, good. And where's the aorta taking the blood to? To the? To the whole body. Good. Okay. Just the aorta though. Where does it go from the right ventricle? We said this was the aorta. Yeah? Okay. So, from the right ventricle, blood is going to go where? To the body?
Yes.
And the left ventricle is going to? So, where is it going to come back from the lungs? Is that good for anybody? Okay. Pulmonary edema yoga is here. You can get pulmonary edema with this, but there is just hypoxia, isn't there? Okay. Because the blood is actually going from left atrium, left ventricle, oxygenated. I mean, does it need to be oxygenated? Doesn't. Okay. So it's one circulation, because this has got 2 circulations. What's happening to the right ventricle? That is getting blue blood into the body. not being oxygenated anywhere, right? So you got two circulations. Agreed? No. Will the baby die at birth? Wait, it won't, because it will die, but it has to have something else. Patent ductus. Okay. So that's why nature is so clever, it will produce the patent ductus. So that's the reason why. If you rang me up in the middle of the night, I said to me, I've got a baby here who is blue. First thing I'll say is, you got a murmur. And they'll say, yeah, it's got a murmur. So I say, great. Why would I say great? Because that murmur is keeping the baby alive. Right? Next day when I go and see the baby, just say, which I won't, I'll go and see the baby straight away, I hope. But if that murmur is going away, the baby will get bluer. So the murmur that goes away in a blue baby is bad. So the murmur is good. Doesn't mean, you can listen to it as मैंने murmur सुना, ठीक से. अच्छा? Okay, murmur आपने सुना. That's actually a good idea in a blue baby. Because if the baby is alive, chances are that's what's keeping the baby. आप ठीक से समझाने सब आज अब तक, अंग्रेजी हिंदी सब mixture ठीक ठाक है ना? Okay. So now we need a connection. Connection can be in 3 places. But nature is very clever. It can sometimes say, right, I'll just give it bonus, आपको VSD दे देंगे. अच्छा? तो VSD आ गया. तो connection हो गया. अच्छा? So now that pink blood can go boop, boop. So the baby is not blue, but it's slightly bluey. But it will survive. Or the nature can be even slightly more generous and give you an ASD or a foramen ovale that keeps open. Fantastic. Or a patent ductus. Yeah. But remember, patent ductus is telling you, I'm going to close if you don't do something about this. So I'm just warning you. Okay? There's a murmur there, so you guys listen to it. If I'm going to go away, don't blame me. Huh? ठीक है? Okay. So that's how this thing works. And as far as operations is concerned, I'm not going to talk to you about it because as students you're not supposed to know. But nowadays they do a switch operation. Okay? Artery को निकाल के उधर डाल देते हैं, pulmonary को निकाल के उधर डालते हैं. So right one is coming out of the appropriate ventricle. Okay, that's the operation. So, but we don't talk about it. Okay, so you understand this as well. All right. Now comes the interesting bit, which is the interactive bit. And Dr. आपका नाम क्या है? Sorry? Asad surname? Rahman. So Dr. Rahman आते हैं आज हमारे साथ बात करने के लिए. Okay, Dr. Rahman. So I'm going to be sitting here. So you, sorry, I've got the baby. I'm going to sit down. Sabi the better. Make the tip. Okay, and we are going to do it face-to-face. We're going to do face-to-face consultation. Okay. Now, what you do is, I'm sitting here. You've got to come in, shake hands with me, or salam karna, whatever you want to do. But when you come in, I don't want to sit all night. Because sometimes your first impression for a doctor is allowed. I don't think it's really. Yeah, okay? So you've got to be sharp, you've got to be smart, you've got to have confidence, you say the right things, your body language is going to be good. So this is about your communication skills and professionalism. Nothing to do with what I've talked to you about. Okay? So now we're going to use that knowledge. To me, that knowledge is not that important. To me, you as a doctor, I want to put my kid's life in your hands, and I know Dr. Rahman, wow, he's going to sort it out. Okay? Bismillah. Assalamu alaikum. Wa alaikum salam.
I'm Dr. Asad. What's your name?
मेरा नाम है मेरा नाम है रशीद साहब.
Where you come from?
मैं आया दरिया से.
Why you are here?
अच्छा आप ऐसे खड़े रहेंगे? मिलिट्री का मतलब मिलिट्री में काम करते हैं आप डॉक्टर दोबारा शुरू करो. So nice and warm, you know? Okay, so nice and warm. See, जैसे कि you want to make my kid better. आप तो उधर खड़ी कर you're threatening me, you know?
Assalamualaikum. I am Dr. Asid. What's your name?
My name is Rashid.
So, why you are here? What's happened?
Well, I'm unhappy. मैं हिंदी में बात करें. अच्छा मैं काफ़ी तकलीफ में हूँ. मेरी बच्ची दूध नहीं पीती है ठीक से और सांस भी नहीं लेती है ठीक से, उनको वजन भी नहीं बढ़ता है. मुझे लगता है कुछ काफ़ी गड़बड़ है डॉक्टर साहब.
ये कब से है ऐसा?
ये वो मुझे लगता है जन्म से ही कुछ ना कुछ प्रॉब्लम.
कितनी डेज की?
बच्ची का 4 हफ्ते हुए.
जब ये पैदा हुई थी तब ये सही थी जब इसका जन्म हुआ?
हाँ, वैसे तो डॉक्टर साहब ने कहा कि ठीक है. हम डॉक्टर से मिले तो डॉक्टर ने कहा कि कुछ मर्मर वगैरह कुछ नहीं है. तो हाँ, यानी बहन ले आया, सब हमने हंगामा किया. सब परिवार से सब आए, नानी दादी सब आए. अब नानी दादी कहती है कि बाबा देखो कुछ ना कुछ गड़बड़ है. तो दादी जब कहती है कि गड़बड़ है तो I'm not making it interesting.
इसकी जो डिलीवरी हुई थी बिल्कुल नॉर्मल हुई थी?
हाँ, सब नॉर्मल.
फुल टर्म पे 9 मंथ्स के बाद या उससे पहले?
फुल टर्म मुझे पता नहीं चला.
नहीं, 9 महीनों के बाद पैदा हुई थी या उसको कुछ?
हाँ, पूरे
दिन.
I know a little bit more about Hindi than you do, kid. Hindi में बात करो because it's what you do because you speak English, no problem. मेरा प्रॉब्लम क्या है?
मसला क्या है इसके साथ, बच्चे के साथ?
वजन नहीं बढ़ता, दूध नहीं पीती ठीक से और रो रही है. कभी सांस में भी तकलीफ है मुझे लगता है. आपको लगता है ठीक है?
नहीं, मुझे तो नहीं लग रहा क्योंकि आप
तो मैं दूसरे डॉक्टर का पास ऐसे करो. It is very hard in front of a lot of people. Yeah, I think he's doing a brilliant job. I'm just making it light-hearted for you guys because you know medicine की teaching जो है ना, it is fun. Okay? So ये आप जैसे इधर it's exactly like the belief capability. Okay? And that's why people enjoy it. They enjoy it. And that's the way to learn. If you're enjoying it, you're going to learn. Miserable or you're going to okay? Achha, you're doing very well. So now we know. Okay, आपने you know one of the things is weight loss. So attack the weight.
जब ये पैदा हुई थी तो इसका वजन कितना था?
Some people से पता नहीं और some से 6 पाउंड.
तो उसके बाद ये कितना बढ़ चुकी है?
मैंने वेट नहीं किया लेकिन वो जो मार्केट में जाते थे तो मैंने बेबी को रखा वो स्केल पे तो 7.5 पाउंड. तब उनकी उम्र है 5 7.5 पाउंड. ठीक है आपको. Anybody asks you that, you say, ऐसे करें हम या पहले बात कर ले ठीक से. If you don't know the bloody answer, what you say is, थोड़ा बात कर ले, फिर मैं आपसे कहूँगा. Because she'll probably forget the question anyway before. Okay? So you've got to have the technique at the same time doing the confidence. अच्छा ठीक है. तो फिर हाँ तो वजन अब 7.5 या करीबन 8 होगा.
तो ये दिन में कितनी मरतबा आप इस फील्ड पर आते हैं?
मैं अपना दूध देती हूँ और जब रोती है तो मैं देता हूँ दूध, लेकिन वो इतना दूध नहीं लेती है.
तो इसके जो आप तारी या पीली नीली हो रही है
नीला मैंने नीली नहीं देखा मैंने, लेकिन मुझे पता नहीं, हो सकता है लेकिन जब सो रही है तब होगी, मुझे पता नहीं।
जो आप इसकी ब्रेथलेसनेस का बता रहे, ये कब से है?
क्या क्या
जो सांस है उसकी
हाँ,
तकलीफ है,
सांस
ये
का
कब से है?
अच्छा ठीक है। Now what you could do is you could go to breathlessness, go back to this Neela, because that's learning point for you. जब आप दूध देते हैं और वो रोती है, तब नीली होती है या नहीं? जिन्हें हाँ कहा तो then you say ना ये बड़ा प्रॉब्लम है, समझे ना? उनको मत बताना, आपके फेस से मत बताना, लेकिन दिल में तो जरूर रखना कि ये ज़रा प्रॉब्लम है, because आप फेस से बताएंगे तो मैं ज़रा फेंट हो जाऊँगी, ठीक है? So what you need to do is you need to tell me, ask me about the cyanosis, because condition that cause cyanosis is going to be stress. Feeding is stress, crying is stress. Okay, it's like going up the stairs for a child. Yeah? So, push up.
जब आप इसे दूध पिलाते हैं तो उसके बाद दूध पिलाते हैं तो इसके बाद इसका कोई रंग तो होगा, तब्दील होता है जब ये रोती है उस वक्त कुछ होता है?
डॉक्टर साहब आपने सही बात की, क्योंकि मैं जब दूध देती हूँ ना तो ये थक जाती है, मुझे लगता है, और थोड़ा कुछ नीली भी हो जाती है, तो फिर दूध नहीं पीती, फिर रोती है, तो फिर मैं दोबारा दूध देती हूँ, तो वही होता है, पता नहीं क्या हो रहा है, अल्लाह जाने। I mean, I've been there yesterday, so they've told me all these new tricks, you know. You're doing very well, okay? It's not easy to stand, I tell you. I mean, I've been doing this for years, so to me it's easy. I'm not making fun of you, honestly. Like, it's interesting, that's how you learn.
और जो सांस ब्रेथलेसनेस का बता रहे हैं,
सांस की तकलीफ मुझे लगता है जन्म से ही है।
जन्म से
जी।
ये खुद ब खुद ही हो जाते हैं क्या, रोने के बाद या फिर
ज़्यादा रोने के बाद?
रोने के बाद।
लेकिन मुझे लगता है कभी जब सोती है ना तो उनका सांस भी, मेरे पास करीबन 8 दूसरे बच्चे हैं, तो वो तो ठीक है मुझे लगता है, लेकिन ये थोड़ी कुछ डिफरेंट है।
तो वो जो आपके पहले बच्चे हैं वो सारे बिल्कुल ठीक हैं, उनके अंदर कोई भी इसी तरह का कोई भी मसला नहीं है?
वो सब ठीक है। एक तो बच्चे 22 साल की, वो काम करती है इस्लामाबाद में, अल्हम्दुलिल्लाह वो ठीक है, लेकिन दूसरे बच्चे सब स्कूल में हैं आज, वो भाई पता नहीं किधर है आज। मुझे लगता है वो मोटरसाइकिल पकड़ेंगे।
आपकी एज कितनी?
करीबन 40 साल की होगी, लेकिन मैं थोड़ी सोचता हूँ कि ये रेलेवेंस है, वो सब हो भी सकता है, ठीक है। पॉसिबिलिटी है कि डाउन होगी, कि थोड़ी कुछ नीली हो जा रही है मेरी बेबी, और दूध नहीं पीती ठीक से, उनको पसंद है, वो 5
क्या मसला होता है इसलिए से नीली हो जाती है?
नीली हो जाती है, पता नहीं, आप जानते हैं, आप तो डॉक्टर हैं।
ये दूध वगैरह ठीक रहती है?
तब जाता है, मुझे लगता है वो तब जाती है,
अच्छा,
लेकिन पता नहीं उसकी मूड के अंदर प्रॉब्लम है या क्या।
अच्छा, जब ये रोती है तो इसका मतलब रंग वगैरह क्या होता है?
हाँ, ऐसे बोली से रोती है ना तब थोड़ी कुछ नीली हो जाती है। मेरे पास दूसरे बच्चे ऐसे नहीं होते।
अच्छा, आपके पहले कितने बच्चे हैं?
7 दूसरे बच्चे। मैंने आप बोल मैं बच्चे हैं मेरे पास। 35 days यानी समझ लो 35 ounces, सीधी बात, okay? You got birth weight 6 pounds 10 ounces. Minus 10 ounces because babies lose first few days, they lose a few ounces. So rough कर देते हैं. Okay. So that means the baby 6 pounds plus 35 ounces. Are you with me, everybody?
Yes.
Yeah. Because the formula is birth weight minus 10 ounces plus days in ounces. So 6 pounds and 35 ounces. 35 ounces is how much? Here 2 pounds 3 ounces हो गया ना? Huh? So the baby is 8 pounds and 3 ounces. But this baby is only 7.5 pounds. Yeah? So the baby is not doing well. In fact, it should have been around 8. If anything, it should be 8.3, 8.4. So at least something tells you, yeah, this baby is not feeding well. So now you go to decide, why is the baby not feeding well? Breastfeeding. So what is the first thing that goes through your mind? Breastfeed kar rahi hai, no weight gain. She's come with a breathing problem. But you've got to decide as a doctor, what else could it be? A mother who is breastfeeding, the baby is not putting on weight, what tells you?
Nutritional deficiency.
The baby at mum hasn't got much breast. Yeah. Yeah. So she might have to change if she can afford it. You get it? So the baby, the thing, I don't want you all to go and, whenever this baby not feeding, cardiac problem, because, you know to think there may be other problems why the baby is not putting on weight. Okay. So this is how you work out a weight of a baby in the first 100 days. Okay. Because if, I'm 67 something, so if that's the formula used on me, I would actually be much bigger than this room. Okay, so this is for the first 100 days. Okay. But if you want to know for the first couple of years, I'll give you some clues. 7 pounds at birth. 14 pounds at about 4 months. 21 pounds at about 1 year. 28 pounds at 2 years. There seems to be some sort of logic in this. This is rule of 7s. Until 2 years, you're okay. I can go until 7 years if you want. Because 7 years is actually 49. In between it breaks down. So I'm not going to tell you about how it breaks down. For 7 years, आपने मुझे कहा कि मैं बच्चा आपको बेचता हूँ. The kid is actually 3 years old. I'll say it's 33 pounds, roughly. Okay. If you say it's 2 years old, I'll say it's 28 pounds. Because rule of 7s comes in. Okay? So this is how I use it. I don't use all these formulas, Which formulas do you use for weight? Age plus 4 times 2. How do you know a child is doing weight, doing well? And if it's a 4-year-old, how do you know his weight is normal? You just guess, look in the books. That's it, that's an important point they should learn.
82 plus 8.
How do you know? You see, you have to see a child and say, this kid is not doing well. It's just by looking at it sometimes, or sometimes by working out the weight.
Calculate the ideal weight through age into 2 plus 8. This is the formula.
Yeah, there is a formula, isn't there? But that you use from the age of 1 year. 1 year to 10 years, you use the formula age plus 4 times 2. Age in years plus 4 times 2. Okay? That's the formula that we use for children from the age of 1 year to 10 years. That is useful when you're doing pediatric immediate life support or something like this. When you're working in casualty, somebody rings up and says, there's a 7-year-old child. I'll just say it's 49 pounds. What's all this about this formula, 49 pounds is what, 24 kilos, rough and ready. Because as a pediatrician, I know, I can work it out very quickly. But you've got to have some sort of formula to work on. Okay, so that's just deviating, but it's good to know that a child is failing to thrive. You've got to decide whether the child is failing to thrive because of another reason. Mother might not be feeding it. Or there's inadequate feed. Or the baby's vomiting. Or the baby's got diarrhea. Or the baby's got a cardiac problem. In this situation, the baby's got a cardiac problem. So we'll carry on and see how we get on now. Okay? So family history is important, we said. Just clear this up. So first of all, आपने कहा family history, drugs, उनको consanguinity कहते हैं, याद है ना? Yeah. What's consanguinity? Do you know? Cousin marriages. So we've gone through all this, and now you see, I've come with 3 problems. So right. So the doctor should come and say, right. Firstly, let's look at the first problem. Weight. Okay. What's the weight? Have you got any other weights? अब कितना weight है? उनके पास नहीं है, तो आप check करेंगे. That's the weight story done. But from the point of view of the baby not feeding, you can ask the mother to feed. Now, if she's breastfeeding, she's not going to breastfeed in front of you, unless you are in a different country. So you can say, okay, a nurse can check and see if the baby is breastfeeding properly. Because remember, thing is, to be a good doctor, you've got to be simple. And at the same time, you've got to be complicated. All right? If the baby's nostrils are blocked, do you think the baby's going to feed? No. Why? Because they're obligatory nose breathers. Yeah? You do that to the baby, and the baby will go recessing. And in fact, anything you do to the baby will start recessing. So blocking the nostril is not a good idea. So I guess sometimes the babies, it's not feeding. So I look at the baby and go, stick some nose drops on something, and suck the nostrils out, and the baby starts feeding. Yeah? So you've got to look at simple reasons why babies don't feed. And then you can go to the complicated ones. And heart is a complicated one. Yeah? If you've got a large VSD, kids in cardiac failure is getting tired. And that's what we are looking at as a cardiac case. This baby's getting tired. The point I'm making to you deliberately is don't go tomorrow. Any baby that presents with not feeding very well has got a cardiac problem. But have a listen, because at least now you're a bit more informed. Okay, so right. So from the history, family history, so looking at the feeds, now we're going to examine the baby, all right? So now I'm going to show you how to examine the baby. So it's going to be a bit more difficult. Now, what's the best way of doing it, Doctor? So I want to show them something at the same time. You see, baby can't be. Okay, now examination of the baby. If in doubt with anything you like, always start from the baby. Okay, nothing wrong with that. You could be zeroing there. But I tell my students, who sometimes I know are zero, so I actually train them differently. I say, you want to pass an exam, this is what you do. If in doubt, start from the beginning. So, they will start from the fontanelle. Understand? At least that's a start. Is it relevant to this issue? Is it? It is relevant. Yeah. So at least from a cardiac point of view, yes, fontanelle is relevant. Because if it's sunken, the baby is not feeding well. In fact, so the mother is right in what she's saying. Okay? So fontanelle come there now. Acha. Here, can you come the other side so I can... yeah, in fact, I can... No, I'll ask them here. Because I like examining from the right side. Always examine babies from the right. Because, right hand is your hand in a sense. So... I think I'm being slow. So because the right hand is actually a dominant hand, yes, he wants me to. So we look at the baby, no touch, all right? But this person starts from the top. But I would say don't even start from the top. Look at the baby. In fact, if a medical student, I go like this. You look. You have to look. ब्रूस ली की फिल्म कितने देखी है? एंटर द ड्रैगन किसी ने तो देखी होगी, आपने देखी होगी डॉक्टर साहब, हाँ? ब्रूस ली वॉज अ वेरी गुड मार्शल आर्ट्स का, याद है? आप देखा होगा लेकिन हाँ नहीं कहते। हाँ, उसने जब उनका मास्टर के पास गया वो ऐसे करता है, नीचे देखा। अच्छा, लेकिन मार्शल आर्ट्स मस्ट ऑलवेज कीप द ओपोनेंट इन हिज आई साइट। तो उनका मास्टर ने उसके ऐसे मार दिया ऊपर। ऑलवेज लुक एट द opponent because you will lose the heavenly glory. अच्छा? Similarly here, always observe, otherwise you will miss the main features. So जब मैं टीच करता हूँ तो वो मुझे याद आ जाता है, मेरा बचपन आ जाता है. Okay. So always look at the baby's color. Color क्या है? Let the baby cry. See what the baby is doing. Tells you a lot just by looking at the baby. If he's moving all his arms and legs, has got a good cry, chances everything is all right. Huh? If he's going, yeah, there's something is not right about this. Okay, the Glasgow coma score is not that great. वो तो जानते हैं ना Glasgow coma score. Maximum कितने होते हैं? 15. Least कितने होते हैं? 3. Great. Okay. well trained, either. Okay. So we got this baby just to look at. Now, I'm going through all those things that I've mentioned to you. Right. Now, if it's an older child or a younger baby, it doesn't matter. Remember, clubbing comes after 6 months of a congenital cyanotic heart problem. Many reasons for clubbing. I'm just giving you a cardiac reason. Okay, and it disappears after operation if it's operated properly and the problem sorted out. So having looked at the baby just generally, then you say, is the baby thriving or not thriving? Then you put the baby on the chart. You haven't touched the baby yet. The baby is thriving, could have a cardiac problem, but not a bad one. If it's a bad problem, it won't thrive. So it's telling you something. Yeah? That information is giving you something. That information is giving you something to go on. The baby is solid, alhamdulillah, you know. MashaAllah, tandurust bacha hai. Chances are he's got something wrong, but not too bad. Okay. So then, you want to touch the baby. Now, these touches are going to be very important. आपने ये देख लिया, अच्छा? आँखें में देखेंगे, आँखें में कभी-कभी ऐसे करते हैं. Can I just do it on you? You know, some students go like this. Yeah. Okay. So they start crying. So ये आवाज़ जो है ना, आवाज़ भी होता है. You just keep your आवाज़ slightly soft. जैसे बात करते हैं वैसे. हमारे पास एक इलेक्ट्रिशियन है, ऐसी बात करते हैं, वो रूम में आते हैं ना, सब बच्चे चुप. So if your voice is which you go on the side like that. But then, you see, when you examine the baby, you find, you got an anemic head. What does that tell you if it's anemic? You probably had heart murmur anyway. Yeah, so cardiac examination is already started. You have to check. So you put that on your RAM system. कि ये cardiac problem होगा, लेकिन heart murmur भी होगा because the baby is anemic. So then, all the bits that I've taught you, I'm going to question you on this. इधर से नीचे आए, okay? JVP and I forget about it in babies. हम नीचे आए, इधर आए. Okay. Suprasternal notch, aortic stenosis and pulmonary stenosis. So we feel in that. अच्छा, इधर से ऐसे आए. Look at the nails. ये हाथ जरा dislocate करना पड़ेगा. अच्छा, what am I looking for? Clubbing. I'm getting my eyes at that level. अच्छा, आपने जो students होते हैं ना, जो लिखा है ना, वो जैसे कि डायरिया हो गया, verbal diarrhea. अच्छा, तो हाँ, no clubbing, अच्छा ठीक है, pulse ठीक है. And it takes long time to actually, it's the longest is actually, that minute is the longest one that they do. There's no point in actually checking it, the pulse rate. More important for me to know it's present or not, firstly. Secondly, okay, make sure there's no injury in the shoulder. Otherwise, ये जो टूट गया होगा ना, आप तोड़ डालेंगे completely. Okay, make sure कि कुछ गड़बड़ नहीं है, because you'll be looking at adults as well. Right? So yeah, if you think this is, so what am I learning from the pulse? The what? Tachycardia हो सकता है, which could be as a result of. But listen, I think tachycardia is best probably measured by that. But that is good. At least it'll give you an idea. You see, if the baby is tachycardic, let's go back to tachycardia. It'll be going like this. If it's a cardiac baby going like this with tachycardia, it's called cardiac failure. Finito. That's it. It's done. Can you see the reason? Tachycardia, recession in the chest, and the baby has got a heart problem, got cardiac failure. Which condition of those? We're going to go through those 8 conditions. We've done one already. Patent ductus arteriosus, because you have to check for. This is, when you become a bit more experienced, it could give you collapsing pulse. Okay. ये हो गया. We're looking at the hands here. What are we trying to get rid of? in the nails? Cyanosis. So which two conditions are we looking at? That's right. If the baby is 6 months or older, probably be some clubbing. If it's a newborn baby, there'll be blue, but no clubbing. ठीक है ना? Okay? As I said to you, not all tetralogy fallow babies are blue at birth. They become blue later on because it's pulmonary stenosis that's going to cause the problem. Okay? You understand that? So I'm going to use the knowledge we've already used in the examination of the baby. So I'm not going to tell you anything new. Okay. Here, okay. Okay, you have me look at the chest. And the baby might be breathless. Possibility, eh? There could be other reasons for breathlessness. Pneumothorax, could be anything. Because baby doesn't come. I have got a VSD. You know? They don't do that, do they? It would be lovely if they did. But if they came in, future के अंदर plug in कर देंगे, VSD. चलो भाई, operation. Okay, so that will come inshallah. We don't know. Okay. So ये देख लो, equal movement है या नहीं है. उनका impulse कैसा है. You can sometimes feel an impulse, see an impulse. अच्छा? एक चीज मत भूलना. This is the catch. I've got 2 patients मेरे पास हैं. तो कहते हैं apex beat ठीक है. मैंने कहा बाबा apex beat ठीक है. अच्छा? Dextrocardia. Don't forget. Okay. अच्छा? Then you put your hand there on the sternum area. That is how you do right ventricular. Okay? And then as if sternum, you feel the right ventricular impulse, especially in babies. Left ventricle, there. And then, with that part of the hand and this part of the fingers, you feel the thrill. And the thrill is positioned where there is the maximum murmur. Okay? Because sometimes you're not sure. Okay, that's it. And then you can go downwards. Feel for the spleen. In cardiac failure, spleen may be enlarged. But definitely, liver will be enlarged. Now, feeling for the spleen. There's something special about it. Nothing to do. Cardiac, don't go where the cardiac causes spleen. Splenomegaly. Very rarely it might. So causes of splenomegaly, cardiac, forget it. Okay? But because I'm just teaching you generally, just give us spleen. Characteristics of a spleen. Examination.
You start from the right iliac.
Right, good. You start from the right iliac fossa. 1.
Towards the costal margin.
Towards the costal margin, that way. Good. Next. Sorry?
At the level of 9 costal cartilage.
Yeah, I think the thing is it's in that area. So any other bullet points?
Move with respiratory movement.
Sorry?
Move your hand with respiratory movement.
Move your hand with respiratory movement because it moves with respiration. Good. Third one?
Do bimanual examination.
Sorry?
And do bimanual examination.
Bimanual इसकी नहीं हो सकती. Not spleen, kidney. Kidney is bimanual. You can't get above it. Huh? Because it's there. But bimanual is kidneys, not spleen. Okay? Good. This is why I'm teaching you this bit. Anybody else with spleen? Notch is mad.
Notch.
Notch. You can feel the notch in there. Okay, so quite a bit, So, I think Alamia has actually made a body, but it's made things in such a way that you can actually work it out. Budito Diana. Yeah? So you should be able to work that out. So we've done that. And then liver again moves with respiration. And liver, you start here, and then you as the baby's breathing, you go upwards and see if it's there. And now this is important. Feeling of the pulses is there. Femoral pulses. Okay? Fingers. And after you feel hundreds, what you do, just put your finger there and you can feel it. Okay, so that's how we do it. And then, if you want to, if it's a baby, feel dorsalis pedis if you want. Some children, if you really are clever, you can get clubbing in the feet, but we won't talk about that. And in some conditions, you can get clubbing in one side only. That's another story. Okay? And then you put the baby out this way, you sit to the back. And then the examination is done. Doesn't matter how old the child is. Okay? So that's how you would examine the baby. That's how you take a history, as I've suggested to you. And all the bits that we've used on the principles of what I taught you earlier. So going back on the 8 lesions, look at the nails, we're trying to get rid of the 2. The thrills themselves will tell you what VSD is. There might not be thrills if it's small VSD or ASD, but at least you look for them. Femoral pulses, coarctation, picture deck, pulmonary stenosis, and also patent ductus can give you. Okay. That I think is at the end of my, though 2 hours over, I can speak for longer, but I think my voice is going and you'll be fed up of me. So, any questions? Anybody any questions on anything? Because I tell you what I'll do. I told you we will just do 5 minutes. 5 minutes of one thing. I'm just going to pick on somebody and tell them what one thing they have learned today. Okay? What's one thing you've learned today? But not generally. I've learned cardiology. Something specific. Like, for example, patent ductus gives you machinery movement. Yes. I won't say supersternal notch, you get thrilled, you feel the aortic stenosis. Right, I'm just going to go random. Yes, everybody's going to be okay. Once there, the child is vomiting or not feeling well in a cardiac failure situation, that's okay. Everybody's going to one answer without answering. Okay, so what I'll let you throw out. What have you learned about cyanosis? 5 varieties. Okay, what have you learned about ASD, boys? Sorry, ASD, ASD. There is not at ASD level. Second heart sound is? What does it sound like? Give me an example. Okay? If you're talking, then you talk to me. Step up, left hand. Look here. So about no problems. Tell me what have you done? Next. Eisenmanger left dimension comes with 3 regions. See that? Plug in, yes, it has it. It goes away after an operation. So, okay, जब weight calculate करते हैं, तो what sort of formula we use? Birth weight. For the first 100 days. This is just weight. This is just weight. Can you see? With the steps, there's no point in showing you anything. What did I hear? First heart sound. There's a murmur. Just to finish. Sorry, my egg is moved here. Innocent murmur. You want to coffee important, isn't it? Innocent murmur, I'll just tell you about it. It's usually always systolic. Always systolic. Diastolic murmurs, there may be some problem. दूसरी चीज, they've got no thrill. Thrill होगा तो it's not innocent. Thirdly, it does not radiate. That's the innocent murmur. Fourthly, because stills murmur कहते हैं. Now सुना है ना? Lie the child down is a vibratory noise. You can hear it better, vibratory noise, with the bell. But most, this is important, most of the other murmurs in children you hear with the diaphragm because they're high-pitched murmurs. Okay? So when you examine, you can hear the first out sound. There's a murmur between the first and the second out sound. I can't hear anything between the second and the first out sound. So there's diastolic murmur, which varies with posture, varies with breathing, okay? And it's got qualities of an innocent murmur that does not radiate. There's normal femoral pulses and normal cardiac impulses. So it's an innocent murmur. 100%. Okay? Good.